All right, so we've got another deep dive ready to go, and this one is a case that one of you sent in.
Oh, cool.
Yeah, it's a good one. We've got a 58-year-old man. He's presenting with a growth in his mouth,
Hmm.
and it's been there for about 3 weeks, and painless. So that's an interesting detail right there.
Yeah, definitely.
So some of the key details, they said that he's a smoker,
Okay.
like been smoking for a long time,
Hmm.
38 years.
Wow.
Yeah, a pack a day.
Okay.
Recently made the switch to smokeless tobacco,
All right.
but also drinks socially.
Gotcha.
And on physical exam, he has these white patches on his gums,
Hmm.
and they're described as having a granular texture to them,
Okay.
and you can't scrape them off.
Interesting.
So they did an initial HIV test, and it was negative. So we're going to kind of go through and try to figure out, like, what are we looking at here?
Yeah, let's break it down.
What are some of the possibilities?
Right off the bat, the fact that it's a non-scrapable white growth on the gums, combined with this long history of tobacco use,
Right.
both smoking and smokeless, that really narrows down our focus. And then the fact that it's painless, that's
Yeah.
also important.
Yeah, absolutely. And they were also able to get a biopsy.
Oh, perfect.
And that's going to give us a little bit more information to work with
Yeah, for sure.
at more of a cellular level. So what did that biopsy show?
So the biopsy showed a couple of key things. First of all, there was a marked increase in the thickness of the stratum corneum.
Okay.
That's that outermost layer of the skin.
Right.
And that thickening, we call that hyperkeratosis.
Hyperkeratosis.
Yeah, and then second, we saw something called parakeratosis,
Okay.
which means there were nucleated cells present in that stratum corneum.
Interesting.
Now, normally those cells would have lost their nucleus as they move up to the surface.
Yeah.
But in this case, they still had them. And these two findings together, that hyperkeratosis and the parakeratosis, they're really, really important when we're talking about lesions in the mouth.
So we've got these two big clues, right? The hyperkeratosis and parakeratosis. And we see these white patches. And I mean, just kind of from like a clinical standpoint, you think oral candidiasis thrush.
Right. I mean, that's usually one of the first things that comes to mind.
Yeah.
But it's not really fitting here.
Why not?
The most common form of oral candidiasis, those white patches, they scrape off pretty easily with like a tongue depressor.
Ah, okay.
And we know that's not the case here.
Right.
There is another type that's non-scrapable,
Yeah.
but it usually shows up in different spots, more like at the corners of the mouth. Plus, if it were candidiasis, the biopsy would show, signs of fungal infection.
Right.
Like you'd see the actual fungus under the microscope and you'd see inflammation.
Gotcha.
And they didn't report any of that here. So because it's not scrapable, and because of what the biopsy is showing, it's looking less and less like candidiasis.
That makes sense. All right, so we can kind of rule that one out for now.
Yeah.
So then you start thinking, okay, well, he's 58 years old, has this history of smoking,
Right.
drinking. So what about squamous cell carcinoma?
Oh, yeah, that's definitely something we got to consider, given his risk factors.
For sure.
And, early squamous cell carcinoma can look like a white patch that doesn't scrape off, just like what we're seeing.
Okay.
But the thing is, when you look at the biopsy for squamous cell carcinoma, you'd see these abnormal cells and they'd be growing down into the deeper layers of the tissue.
Okay.
And that's not what we're seeing here.
Right.
So based on this biopsy, it doesn't look like it's full-blown squamous cell carcinoma yet.
Okay.
But it's definitely something we got to keep in mind because remember, this is a precancerous situation.
Right. Yeah. So it's not cancer yet, but it's something to watch really, really carefully.
Exactly.
All right. So we've ruled out a couple things. What about oral hairy leukoplakia?
Okay. So with oral hairy leukoplakia, you do see hyperkeratosis and parakeratosis on the biopsy, just like in our case.
Right.
But there are a few things that don't match up.
Okay.
First of all, oral hairy leukoplakia, it usually shows up on the sides of the tongue. Not on the gums like we're seeing here.
Oh, interesting.
And the texture is different too.
Okay, how so?
Oral hairy leukoplakia has this kind of hairy or feathery look to it.
Yeah.
And in this case, it's described as granular.
Oh, okay.
And another thing that's important to remember is that oral hairy leukoplakia is often associated with a weakened immune system, like in people with HIV.
Right.
And we know that his HIV test was negative.
Okay, so that's another one that we can kind of put aside then.
Yeah, it doesn't seem to fit.
All right, so one more that I was thinking about, and maybe you can tell me what you think about this, is Lichen planus.
Lichen planus. Yeah, that's a good one to consider too. It can definitely cause white lesions in the mouth, and it does tend to affect middle-aged individuals. You can sometimes see hyperkeratosis and parakeratosis with lichen planus.
Okay.
But what usually gives it away is this really distinct pattern of lacy white lines. They almost look like little spider webs, and we call those Wickham's striae.
Okay.
And that's not what we're seeing here. Remember, it's described as granular.
Yeah.
Plus, when you look at the biopsy for lichen planus, it usually has some very specific features, like certain inflammatory patterns that aren't present in this biopsy.
Okay.
So it's not really matching up with lichen planus either.
All right, so we've gone through and we've kind of ruled out these possibilities based on, what we see clinically, the patient's history, and then the findings on the biopsy. So what are we left with? What seems like the most likely explanation?
Okay, well, taking all of that into account, the non-scrapable granular white patch, the fact that it's on the gums, his history of heavy smoking and alcohol use, and then the biopsy showing hyperkeratosis and parakeratosis, but no other specific features. The most likely diagnosis is oral leukoplakia.
Oral leukoplakia.
Yep.
And that is a precancerous condition, right?
Exactly. It's not cancer yet, but it can develop into squamous cell carcinoma over time.
Right.
And it's directly linked to those risk factors you mentioned, smoking and alcohol.
Yeah, and it can occur on the gums.
It sure can. Any part of the mouth, really.
Right.
And the hyperkeratosis and parakeratosis that we see on the biopsy, that's a classic finding with leukoplakia.
Interesting.
The important thing to remember here is that although it's not cancer right now, it has the potential to become cancerous.
Right.
So monitoring it and managing it appropriately is super important.
So based on all the information you shared with us, it sounds like oral leukoplakia is the most likely diagnosis for this individual. And it really highlights how, you can have symptoms that seem really similar on the surface.
Definitely.
But when you dig a little deeper, looking at the patient's history, doing that biopsy, you can figure out that the underlying cause could be totally different.
Absolutely. And it just goes to show how important it is to pay attention to those changes. Even if they seem small, early detection is key.
Absolutely. And I think this case really brings that home, It makes you stop and think about what seemingly minor changes in our bodies might be trying to tell us.
Couldn't said it better myself.
All right. Well, that is going to wrap up this deep dive. We want to thank you all for listening and keep those cases coming.
Yeah, keep them coming.
See you next time.